Pressure. Descending to the ocean floor, we experience a dramatic increase. Just 33 feet down, the pressure has doubled. We can equalize the air spaces in our ears, sinuses, and mask. We have no other sensation of the force pressing on our bodies. But pressure does affect how our bodies react to the gases in the air we breathe.
In this program, we'll take a look at basic human physiology, respiration and circulation, and how pressure and physiology interact. We'll present concepts of partial pressure and the solubility of gases in our bodies, and we'll discuss some basic time and depth guidelines for underwater excursions.
The air we breathe is composed of approximately 21% oxygen, 78% nitrogen, and a small amount of trace gases. We need oxygen to live. Our muscles and tissues use oxygen in the process of creating energy. And as a byproduct, they produce carbon dioxide, which must be eliminated. Our respiratory system allows us to take in air and exchange gases, getting the oxygen we need while ridding the body of excess carbon dioxide. Inside the lungs, clusters of small sacs called alveoli allow oxygen to pass into the blood and carbon dioxide to pass into the lungs. When we work harder, we use more oxygen and produce more carbon dioxide. The buildup of carbon dioxide triggers an increase in our breathing rate. The circulatory system is a delivery network, bringing oxygenated blood to our cells and tissues and carrying carbon dioxide back to the lungs to be exhaled. The heart pumps blood to the lungs, where carbon dioxide is exchanged for oxygen, then back through the heart, where it's pumped out to all parts of the body. Vital oxygen is delivered and carbon dioxide picked up for return to the heart.
Under increased pressure, the gases in the air we breathe can have dangerous effects on our physiology. The effects vary for each component of air, so it's important to understand the different pressures and therefore depths at which problems can occur. The air we breathe is at the same pressure as the surrounding pressure. At the surface, oxygen contributes about 21%, or 0.21 atmospheres, while nitrogen represents about 78%, or 0.78 atmospheres. Each component of air contributes to the pressure proportional to its percentage in the mixture. We call this partial pressure. At 33 feet in seawater, the total pressure has doubled to 2 atmospheres. The partial pressure of each gas doubles as well. At the surface, gases are dissolved in our blood, bones, and tissues as much as possible, so we are saturated at 1 atmosphere. When we descend, increasing partial pressure increases the solubility of each gas in our bodies. We absorb more of each gas, first in our blood, then in our tissues as the blood circulates, a process called ingassing. If we remain at depth long enough, we will absorb enough to be saturated at the new pressure. When we return to the surface, the excess gas we've absorbed is returned to the lungs and exhaled, called off-gassing. The partial pressure of each gas creates a different physiological response in our bodies.
Let's take a look at the potential dangers of 4 different gases under pressure. Even though we need oxygen to live, pure oxygen has toxic effects at a pressure approaching 2 atmospheres. If you breathe nitrox, a special breathing mixture, toxicity can occur when pressure approaches 5 atmospheres. Even the percentage of oxygen in air can become toxic when pressure approaches 10 atmospheres. Scuba divers use air tanks filled with air and should remain within the depth limits set for recreational divers. The use of special gas mixtures for special diving applications requires extensive training. Carbon monoxide is a tasteless, odorless gas that is toxic at any partial pressure. Even small amounts of carbon monoxide pumped into a scuba tank due to a faulty compressor system will create serious difficulties. Divers who begin to feel extreme fatigue and nausea during a dive should return to the surface immediately.
The greatest percentage of the air we breathe is composed of nitrogen. When we dive, the partial pressure of nitrogen increases and more dissolves in our tissues. Nitrogen affects us in two ways: nitrogen narcosis and decompression sickness. The physiological responses to each are very different. Nitrogen narcosis presents symptoms at depths approaching 100 feet. The increased partial pressure of nitrogen has a narcotic effect and results in feelings of euphoria or anxiety and a dulling of a diver's mental capability. Mistakes are easily made. If you begin to feel uncomfortable, or perhaps too comfortable, while descending, ascend until the feeling passes, and continue the dive at a shallower depth.
Decompression sickness can affect anyone who dives below 20 feet. To prevent this painful, disabling, and potentially fatal diving disease, we must understand its cause and effect. Remember that during any dive, we in-gas nitrogen, which is absorbed into the tissues of our body. For excursions within specific time and depth limits, this additional nitrogen is harmlessly expired by normal breathing as we return to the surface. Off-gassing occurs rapidly at first, but may take many hours to complete, long after we're out of the water. If nitrogen remains in our tissues before our next dive, it limits the time we can spend at depth. If we remain at depth too long and then ascend directly to the surface, the change in pressure could cause the release of excess nitrogen in the form of bubbles, called decompression sickness, DCS, or the bends. If bubbles form, they disrupt and damage tissues. A diver may experience pain, numbness, choking, or paralysis. These symptoms usually occur immediately or shortly after surfacing, but in some cases, they don't appear for many hours. A diver who suspects they have decompression sickness should seek professional medical attention immediately. As a first aid, breathe pure oxygen to increase the rate at which nitrogen is outgassed. The treatment for DCS to prevent or minimize permanent damage is recompression in a chamber monitored by medical personnel. Inside, the affected diver will be subjected to increased pressure, squeezing nitrogen bubbles to minute size and allowing them to dissolve into the bloodstream. The pressure is reduced very slowly to allow normal off-gassing. The onset of the bends varies with the individual and day to day. It's governed by the amount of nitrogen you in-gas, your physical makeup, and your rate of ascent. 3 factors are important in preventing DCS: remaining well within no decompression guidelines, controlling ascent rate, and preventing dehydration. The dive tables set specific limits for time at depth. They should be used to plan every dive, whether we're making one or many repetitive dives within a 24-hour period. Your dive tables will help you determine the time and depth limits for your next dive, based upon the residual nitrogen accumulated on the previous dive.
Our ascent is actually a form of decompression, a release of pressure at a prescribed rate of 30 feet per minute. Performing a precautionary decompression stop for 3 to 5 minutes at 15 feet during ascent allows an extra margin of safety in eliminating excess nitrogen. These stops are strongly recommended on any dive deeper than 20 feet. Divers who become dehydrated are particularly at risk for DCS. so drink plenty of water before and during your diving day. Your Naui instructor and your textbook will help you understand decompression sickness and the use of dive tables in detail.
In this program, we've seen how pressure affects the gases we breathe and how those gases affect us as divers. Oxygen and carbon monoxide have toxic effects under different conditions. Nitrogen affects us in two ways. At depth, it acts as a narcotic, influencing our behavior. The absorption of nitrogen over time can lead to decompression sickness. With a thorough understanding of how these problems can occur, you're well prepared to prevent them.
Naui's motto is safety through education. Your Naui instructor will help you understand the concepts presented in this program. Be an educated diver. Enjoy your exploration of the underwater world.